Good morning everyone, and welcome back to my channel. In today's video I'm going to talk about something very different, and this is actually going to be a presentation video for a school project I've been working on. So this video is intended to just my subscribers, but also my instructors and the students and my colleagues or everyone else interested. So the topic I will discuss today is critical to patient care, and is commonly known as perioperative anxiety in older adults. The presentation will solely focus on the non-pharmacological aspect to improve the anxiety that older adults experience before surgery. My main aim of this presentation is to propose a policy that enhances changes and integrate the various methods to enhance anesthesia care. So welcome to this presentation, and let us explore together while understanding the urgency of this issue. So let's first start with the overview. So we'll discuss some aspect of pre-op anxiety, especially among older adults. This is a widespread issue among older adults, and according to Aroki and Hicks in 2019, is a study that was made, approximately half of surgical patients are affected by pre-op anxiety before any procedures. This is psychologically concerned, which required urgent attention and should be addressed. So some of the effects of stress and anxiety before surgery include like increase in cortisol level, which may lead to various complications, increasing the heart rate and high blood pressure. This could further lead to a delay in recovery after surgery or longer hospital stays, increasing the cost of healthcare. And now we don't want to forget also about delirium, right, which can put a strain on both the healthcare system and the patients we are taking care of. So today I will share some evidence-based solution to mainly address this issue in older adult patients. So but first we need to understand what is pre-op anxiety. So to manage pre-op anxiety, it is crucial to understand its root. Anxiety before surgery comes from fears, right? Fears about the surgery itself, fear about the outcomes, fear about the complication if any arises. So for older adults, these fears are amplified by cognitive decline, previous bad experiences, and feeling dependent on others. So they have fewer coping resources and mechanisms, and they are more prone to that period of anxiety. So by knowing what triggers them, we can tailor our intervention to their needs and be more compassionate and effective. So what are the non-pharmacologic methods I want to talk here? Non-pharmacological method, I feel like they are a great way to improve periop anxiety without any side effect or without the cost of medicine, especially when we are talking about older adults. We can target things like music therapy, for example, lowers the stress of patient by engaging the brain in a more calming ways. We also have things like guided imagery that let the patient mentally rehearse positive outcome. It makes them feel like they are in control before surgery. Cognitive behavioral techniques give patients tools to challenge and manage their fears. And other things like acupuncture, right? It's not just for like nerves and things. Acupuncture is an old practice that reduces anxiety by stimulating specific points. So these are not only effective, but they are also safe and very cost effective. So we can incorporate them into our practice, and actually they are very easy to incorporate nowadays. So what is the effectiveness of this method that I just cited? So we're going to talk about the evidence of effectiveness. So these non-pharmacologic methods are proven to work in any population, but especially in older adults. A 2021 meta-analysis showed that music therapy alone reduced pre-op anxiety by 30%. This is actually a big number that is often disregarded. So guided imagery, particularly effective in older adults, reducing anxiety by another 40%, according to a study made by Bate and al. In 2018. So acupuncture improved anxiety score by 35% in a 2020 study by Jelena and al. And these are real results, so we can actually use them and incorporate them in the standard of care. They benefit the patient and our healthcare system. So what will be the benefit of implementing all these techniques? So using non-pharmacologic method to manage pre-op anxiety has many benefits, right? Patients get a more personalized care. We talked about few side effects. We talked about reducing the cost of medicine, the cost of healthcare, shorter recovering time, and fewer complications means also better outcome, better patient satisfaction, less burden on the healthcare system. Plus, we are not using any sedative, any anxiolytic, which causes often delirium in patients in the post-op period, especially older adults. So we are one step closer to patient-centered care that values both the physical and emotional well-being of this patient. The ripples will spread throughout the hospital, right, once we start implementing this. So let's talk about the cost-benefit analysis of all this technique. And I hope somebody is interested and eager to implement these techniques, because like we said, they are easy to implement, very effective, very patient-centered care. So when we looked at the benefits of non-pharmacological intervention, we clearly see that the benefits far outweigh the cost. Initial intervention costs would be like training. So we want to make sure that we train the staff to use appropriate this technique. If we take the example of acupuncture, they have to have a proper training, and buying material for things like music therapy, having the right type of music or guided imagery. But those costs are paid back very quickly with less pharmacologic treatment, shorter hospital stays, and fewer post-op complications. And beyond the financial aspect, the patient satisfaction and outcome are priceless. This cost-benefit analysis proves that it's doable and it's even necessary. So now I want to touch base on the challenges and the misconception that people might have about this. And we all know that change is hard, right? It's hard to move from what we are used to and just to be diving in something new. So for sure, at one point, we're all going to experience staff resistance, which is a common obstacle often driven by added responsibility or skepticism. So people don't want to do what they haven't done or try something new, and they feel like, oh, we are not getting paid for this extra. So yeah, these are the things that we hit. Time and resources are also seen as barrier, but evidence and resources shows that these methods fit into existing workflow. So misconception about non-pharmacologic approaches can be addressed with education and evidence. Strong leadership, clear communication are key to getting over these hurdles and making the transition smoothly. So we want to make sure that we give the proper education to our staff. We make this transition very smoothly. We spare time, right? We don't want to increase the burden on the staff more than what they already have. So maybe the time that they used to give the Versed, or we can even hire more staff, right, just to fit in and to make this thing another habit. So let's talk about what is going to be the impact of this on the stakeholder, because it's very important. Our hospitals, our healthcare system, mainly run by stakeholder. So this will benefit everyone. Everyone gets its own share. Patient gets better outcomes, shorter recovery time, and higher satisfaction. Staff gets tools to provide more holistic and compassionate care and more enjoyable work environment. I would like to come to work and play some music, some relaxation music, right? Hospital gets a better reputation, patient retention, and cost savings. Who doesn't want that? And so all these align with our mission to deliver great care and support our long-term goal as leading healthcare providers. So yes, stakeholder can also be happy, and this can be pushed to the next level. Now let's touch base. We don't want to forget what makes the hospital, like the policy recommendation. So non-pharmacological intervention, thoughtful planning, and executions are required to this. So staff training programs should be designed to equip the team with the skill to deliver this intervention. So we're gonna see like regular reviews. We measure the impact of the patient outcome, and we can also use some data to refine our approach. If this working, no, can we put this music therapy in different time, let's say from 8 to 10 a.m. Are we getting enough staff on Fridays? Can we put those sessions on Fridays just to start with? So it is important that we get a feedback loop with patient and staff to allow us to adapt to real world challenges and maintain a high standard of care, most importantly. And finally, a dedicated team is going to be needed to oversee implementation that will ensure accountability and process efficiency for a long-term success. So let's talk about next the implementation timeline of all this, right? Because this is a new project, a new approach, so we really want to have all the facets down before we even dive into this. So our timeline is designed to have a smooth rollout. So the first 3 months will be staff training and getting the appropriate material. This was set up for a pilot in one department for 3 months to test and refine our processes. And we want to get in the less busy department first, the department where people are more open to address those, okay? So the insight from the pilot will guide the hospital wide role in months, like 7 to 12 months. And this phase approach minimizes disruption and allow for iterative improvement so the program will be successful. So we want to go stage by stages, smooth, slow transition, and have everybody ready and on board. So let's talk about what is going to happen next. Next, we need to monitor and evaluate what we are doing. So monitoring and evaluation is key to this initiative. So key metrics such as patient-reported anxiety level, how is my patient feeling before the music therapy versus after the music therapy, and we can compare to that with those who receive Versed, right? And also post-op complication. Is my patient having less post-complication when I'm using non-pharmacological method versus when I use all this anxiety before surgery? These are the key metrics that we can use. We can also use like post-op complication, satisfaction score. Is my patient better awake and up and happy after surgery when I use non-pharmacological method to reduce their anxiety level pre-op versus when other medications are used? So regular audits like this will ensure that we have measurable data on the program. And we also want to follow with protocols and feedback session. The feedback session should be with both the patients and the staff to identify area of improvement. This continuous evaluation cycle will keep the program on track and sustainable. So now I'm gonna touch base on call to action, and I really hope that this gives you a different point of view, a different show to have a different approach when we talk about pre-op anxiety in older adult, and how using non-pharmacological method is very important. So call to action, this is our chance to lead the way in patient-centered care by approving the policy changes, allocating resources, and supporting this initiative. We can set a new standard for the pre-op care for older adults. Let's do this together and keep our hospital at the cutting edge of innovation, delivering care that is compassionate, holistic, excellent, with great patient satisfaction. And I want to say thank you to everybody for taking time to listen to this. If you have any question, please feel free to drop a comment below, like, subscribe, and share. And thanks for your time and considering this. So like I said, I will be happy to answer any question about non-pharmacological method to reduce pre-op anxiety in older adult population. We can make a real difference in our patients' life and live up to our commitment to excellence. Thank you.